Good evening, bienvenidos. I'm Elena Salinas reporting from Miami, Florida, where like in the rest of the world, we are navigating a crisis. The unimaginable has happened. Just in the first half of this year, the coronavirus has taken over 125,000 of our loved ones in the US, more than any other country in the world. And it has put the lives of millions of Americans in disarray. In the middle of the COVID-19 pandemic, la pandemia de nuestras vidas, we are fighting to survive. Latinos and Latinas, along with other communities of color, have become the backbone of the United States during this crisis, all while bearing the brunt of the pandemic. This hour is dedicated to our people, those who need us and those who lead us.
The rich people, they don't even need to go out. You know, they can stay home and they've been tended to.
And the people around here?
It's you know, we struggle to survive.
Since the beginning of the coronavirus crisis, Latinos have been the essential workers on the front lines. The farmers, the grocery store clerks, the delivery people, the meat and poultry plant employees. Jobs that cannot be done through Zoom meetings from the comfort of your home. Only 1 in 6 Latinos has a job that lets them work remotely.
Many of them are balancing. On the one hand, I don't want the crisis of getting sick. On the other hand, I don't want the crisis of being homeless because I can't pay rent and I can't buy food.
They are the ones that keep the economy going while risking their lives.
If you think about the virus as a wildfire, we are dry tinder in a way. If there are no workers, because we get all sick and it's impossible to sustain their work because of that, then there's no food. What are people going to do?
High poverty rates, low wages, insufficient savings, lack of access to adequate health care, the highest rate of unemployment and uninsured of any race or ethnicity in the country.
People of color throughout the world really have been disproportionately affected for many reasons. One is that overall, people of color tend to have lower socioeconomic situations and lower access to health care.
Dr. Eileen Marty is a Navy veteran and professor of infectious diseases at Florida International University in Miami, with decades of experience around the world.
What is the one most important thing that people need to understand about coronavirus and about this pandemic?
This is one of the most lethal viruses that we have seen against humans in decades that is this easily spread. We have modern medicine. We have great techniques. We have ICUs. We have ventilators. That changes the parameters of who dies. If we didn't have all these amazing modern tools, all this new knowledge of immunology, it would have killed 1 billion people.
Dr. Marty knows a thing or two about viruses. For decades, she has been called upon by the World Health Organization to aid in health epidemics around the world, including Ebola in West Africa.
You're Cuban American, so you know the Latino community fairly well. What are the health factors and the cultural factors that make Latinos more susceptible to this disease?
We are a warm and loving people. We love to embrace our friends, which the virus finds fantastic because we're breaking that 6-foot barrier. And that's unfortunate in this circumstance. And it has to do with the health disparities in the country, in part. It has to do with, again, what underlying conditions we're more prone to as Latin Americans. Obesity, diabetes, heart conditions, all those things that make it more likely that we end up in the ICU.
Dr. Elin DeLeon has seen the disease up close and personal at Bellevue Hospital in New York that early on became the epicenter of the outbreak.
It was unlike anything I had seen before and could have imagined for this year.
In a matter of a year, Dr. DeLeon went from a doctor-to-be, graduating from NYU School of Medicine, to the front lines in the war against COVID.
All of this coronavirus pandemic has felt unfair, not only because of the way that patients are isolated in the hospital away from their families, but in the way that they end up in the hospital as well, and the disparities as far as who gets the virus and who doesn't in New York City.
You use the word unfair. That's interesting. Why unfair?
I use the word unfair because I do think, for example, in New York City, there were populations that were able to leave the city. But then there was a group of folks who were considered essential workers who had to continue to ride the subways, who had to continue to present at work, and not be provided with adequate protection against the virus.
Latinos suffered the most deaths of any ethnic group in New York City. Dr. DeLeon says that between 50 to 75% of the patients at Bellevue Hospital were Latino.
I received calls from family members asking whether or not their loved one's immigration status would be in jeopardy because they had been hospitalized for so long, and whether or not emergency Medicaid was going to be covering a lot of their services.
As people around the country are eager for some kind of normalcy, Dr. Marty reminds us that the pandemic is far from over, and she says the debates over whether to wear a mask should stop.
Are masks effective?
Yes. There's no question that masks, study after study has shown, decrease the transmission of this infection. Someone asked me a similar question yesterday, and they said, well, isn't it a matter of our freedom, right, that we should be able to not have to wear a mask? And I say, well, is it a matter of our freedom that we don't have to stop at a stop sign? It's the same concept. I'm protecting myself by not running that stop sign, and I'm protecting you by stopping at that stop sign.
There seems to be pandemic fatigue or quarantine fatigue in the population. As cities begin to reopen little by little, looks like people are not heeding the warning of experts, of medical experts. What concerns you the most about that?
Well, again, the virus really doesn't care whether we feel fatigued or not. And you have to remember that maybe 1% of our population has had this virus right now. At most 6%. There are plenty of people yet for this virus to enter into, and it will do so if we give it the opportunity.
A stark reminder that it's not just about numbers, but about people, loved ones we lost.
I remember the New York Times article that posted around the time where we had 100,000 deaths in the US, and I would say remember that each of those individuals was a father, a son, a mother, a daughter, and that the world has really lost so much.